Joining us now is Dr. Gary Morsch. He founded and chairs the nonprofit Heart to Heart International. He is also a doctor who has helped battle COVID-19 in New York City and Mexico City, two of the hotspots of the coronavirus outbreak. Dr. Morsch, I want to quickly get your reaction to these new global milestones, 10 million cases, 500,000 dead. What did you experience during your work with patients both here in the U.S. and in Mexico?
Well, the pandemic hit New York City, of course, and New York State early and very hard, and they seem to be recovering for now. As you know, the rest of the United States, it seems like we have an upsurge in many states, the majority of states. And then Mexico City, and Mexico itself came along a little bit later, but they are really getting hit hard. I was in Mexico City just a week ago, and we'll be returning soon. But they have not reached the worst of their crisis yet. They've got much worse to come, unfortunately.
And, you know, that being said, the WHO chief says the worst is yet to come and the pandemic is actually speeding up. So what should be happening right now, and why isn't it?
Well, the latter part of your question is the million-dollar question. Why isn't it? But of course, COVID has got such a foothold now, and there's so many cases, so many people that around the world that are contagious, who really are not taking this pandemic as serious as they could. I still see people throughout the United States who are not wearing masks. I go to Arizona frequently. I'll be there actually first tomorrow. In Phoenix, working with the Navajo Nation. And the last time I was in Phoenix a few weeks ago, I was a minority wearing a mask. I mean, most people were not wearing masks. Same thing in Mexico City. I was just there. A lot of people not wearing masks. So we're just not taking this, I don't think, seriously enough. And I don't know what it's going to take, but certainly we've just got to keep working as hard as we can and getting the word out.
Right. I mean, I feel like the message has been bombarded in every direction, social media, TV, radio. We're seeing, though, here in the U.S., cases of younger people rising. What more can we expect with this trend? What are your thoughts when you hear of younger people being part of all these new cases in the United States?
Well, I think you're right. We haven't had consistent messaging throughout our society or our government. We actually have competing messages. I wear a mask virtually all the time. I'm not right now on this call, but I have actually had people come up and really almost harass me for wearing a mask. Like, why are you doing this? Don't you trust in God? I've had people say this. Don't you believe God is going to protect you? Well, yes, of course I trust in God, but I also believe God wants me to use my brain. And so, but there's this kind of, among young people, this almost, I don't know, nonchalance, very, almost a denial, like, we're just not going to pay attention to this. Surely it's not as bad as they think, and we're going to go on with life and, live life to the fullest, and que sera, sera. Whatever happens, happens. And I don't know how you change it. I think it's a function of our society and the way people think. And I don't think you can change that overnight.
We have about a minute left, Dr. Morsch. We're seeing more relaxed rules around the world, travel opening up in parts of the world, some schools reopening. And we've seen some countries, especially in Asia, that have been able to get coronavirus under control. So I'm asking again, why do you think it's been so difficult to follow what's worked in other countries? I mean, it seems like it would be a simple answer, but it just isn't.
Well, I have been traveling. From January, every month, I've been in Asia, Southeast Asia. I've been in South America, and I've been in Central America. I've been one of the few people that are still traveling. And it is true that a lot of smaller countries, Asian countries, took this very seriously and screened people and contact tracing. And that's just not the American way. We're very individualist. We're rugged. We're, not in my backyard. Leave me alone. So part of it is just the way we are culturally. We don't like big government telling us what we should do to protect our health. So it's a problem in our country.
Dr. Gary Morsch, safe travels, and we look forward to hearing from you again soon. Thank you for your time.